a physician, and he does cupping, which is used only in the Scandinavian countries for blood pressure. Again, something our Prophet taught and something that has been totally neglected by the allopathic community, the benefits of cupping. But it's used in allopathic medicine in the Scandinavian countries to this day. And the Chinese still use it also in their hospitals. But I went to this physician, he's a Turkish man. And when I went in, he took my pulse and I was feeling so run down. He said, MashaAllah, 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 pulse, good pulse, good pulse, Allahu Akbar. And then he like got his stethoscope out, he started, MashaAllah, MashaAllah, Allahu Akbar, MashaAllah, good, heart good. Then he listened to my lungs, MashaAllah, Allahu Akbar. You know, and by the end of it, I was feeling so much better. I was just like, I was feeling so good, you know. And now you go to a physician, he's saying, boy, you're in bad shape, you know. By the end of it, you know, okay, just call the undertaker, you know. So, you know, just being positive with your patients, you know, reminding them that things are working. You know, it's, you know, unfortunately we've got a little problem here, but overall, your health is really good. Your lungs are working great. Kidneys are working great. Liver's great. Fantastic. You know, all you've got, you know, a little bit of trouble here in your urinary tract. We can handle that, you know. Just really, just the power of making people feel better, right? This is the thing, physicians just smiling, coming in and smiling. You know, I remember once I had a cardiac patient and I was telling him, look, the best thing you can do is for now is go on a diet. And I was giving him these dietary guidelines, and when the physician came in, he said, you know, the nurse was telling me that I should change my diet and eat more plant-based and do that, and that would help reverse this cardiac disease. And the guy just literally, he said, rubbish. He said, look, there's fats, lipids, and proteins. You know, that's all there is. Whatever you eat, whatever combination, just, you know, have a balance between fats, lipids, and proteins, and you'll be fine. And I said, you know, just really sad that this is the training that a lot of these people have, and the arrogance too is there. You know, I mean, physicians need to be confident. You want to go in and have this guy kind of saying, I'm not really sure, I'm just, yeah, I wish I knew. You know, you want that confidence, but you don't want cockiness, and you don't want that overconfidence. You want confidence with a humility. You know, never give a patient a prognosis of, you know, a death sentence. It's just, you know, it's just such a horrible thing that some physicians do, you know. They told my mother that if she didn't get her breast removed, that she would probably not be alive after a year. That was 7 years ago, and she chose not to have her breast removed. You know, and her oncologist said, you know, you're just like a walking miracle. That might be an anomaly, but it happens, and you can't judge for people. You can't. People have reversals. That same Dr. Mehdi told me that he had a patient that he was brought in for the cardiac problem, and but this patient had cancer of the throat. He couldn't swallow, and they wanted to put in a tube, and they really thought that he wouldn't live much longer. So they told him, and I heard this firsthand from Dr. Mehdi Nasser. He's a brilliant physician. He was the king's physician, cardiologist in Jeddah. And he told me that they sent the man home thinking that he's going to die. And usually in Saudi Arabia, physicians call the families and give ta'ziyah and things. So he literally called this family to give ta'ziyah, like condolences, about a couple months later. And they said, no, he's fine. He said, what are you talking about? He said, he's fine. You know, he's really well. He's eating. He said, no, leave that. You know, he said, can I come visit? And he went. There was the cancer was gone. He could not believe it. And he asked him, what did he do? He said, well, you guys told him that he probably wouldn't live very long, so he wanted to go to Mecca. And so he went, and all he would do was he used to drink through a straw Zemzem. And every day it just started getting smaller and smaller. And then he started feeling fine. So miracles do happen. You know, I wouldn't give people false hopes, but I would always allow for the possibility that we do believe in miracles, we do believe in reversals, but whatever God wants, ajal is ajal, and we can't avoid it. But we should always allow for that possibility of giving hope. Our religion's a religion of hope. We should always look at hope. So I'm really hoping, my hope is the thing with